Some people can become irritated or express allergies to, for example, the jewellery that they wear.
This is when we buy cheap jewellery.
Cheap jewellery.
Is this what we're talking about?
This is what we're talking about.
Green necks.
Yeah.
Eczema goes beyond mere dry skin. It's a chronic inflammatory condition that can significantly impact your daily life. Today, we're diving into the types, causes and management strategies for eczema. I'm Jo Hoare and you're watching The Skin Clinic with Boots. So I've got two experts to chat with me about eczema today. So first of all, Whitney, you're a Boots pharmacist.
Yes.
Do you want to tell me a bit about what that means?
Yes, so I'm a Boots store-based pharmacist. So part of my day-to-day includes regularly and accurately checking prescriptions, also delivering health services, for example, blood pressure checks, offering over-the-counter advice, and also delivering travel vaccinations.
And over-the-counter advice, and that includes skin. So a lot of
Yes.
people come to you to ask about sort of common skin conditions like eczema.
Yes.
And Mina, you're part of the Boots online doctor team. So what exactly do you do for them?
I'm a GP that works with the Boots Online Doctor team. In particular, I work also as one of the clinical leads for the dermatology, so that's all the skin services, as well as the mental health service as well.
First of all, what is eczema? If someone comes to you and you diagnose them with eczema, what does it look like? How does it feel? What are they experiencing?
So eczema is a chronic inflammatory skin condition, present as irregular patches, but you will predominantly have the symptom of itch, which can be very debilitating. It's usually starts in childhood and associated with other conditions such as hay fever and asthma as well. So essentially the three conditions may overlap with each other.
How might it look different on a darker skin tone?
It can look slightly greyish, sometimes even purple. So it doesn't always typically look red on darker skin tones. So.
And you're saying it often starts in childhood. Is there kind of a common age, or can it be right from newborn?
Right from newborn. Most children tend to grow out of it, about 20%. Can remain to have it in adulthood. However, even if children do grow out of eczema, you can then develop adult onset eczema again later on in life.
So could you have never had eczema as a child but have adult onset, or is that unlikely?
It's unlikely, but it is seen.
What are the parts of the body that we're most likely to see eczema on?
So eczema can be presented on our face, also on our arms, legs, all over the body,
So
really.
anywhere really.
Yeah.
And how does it differ from just dry skin?
So we have dry skin, so we have dry skin conditions, but then eczema is really more the inflammatory component of it. So that's where you get the irregular red patches that we see associated with the condition.
So if we think that we have eczema, what are our steps? What should our kind of first port of call be?
So the first protocol should be to come into the pharmacy. We offer a range of emollients. So the key to treating eczema is promoting hydration and moisturization for the skin. So we do offer shower emollients or just normal emollients, so just moisturizers for the skin. If that doesn't work, then typically we move patients to, depending on the area that they are treating, topical corticosteroids.
And when you say emollients, can you just explain a bit more what that means to the person in the street?
Yeah, so emollients are moisturizers basically. They are quite potent in terms of their moisturization factor. They are quite heavy on the skin.
Is the next step RGP?
Yes, absolutely. So if your emollient moisturiser is not settling your skin, then we offer corticosteroids. So it depends on which part of your body is affected, but there are weak, moderate and potent steroid creams that we can offer or use. Usually for a flare-up, it's used for around 2 weeks, but then a further assessment's required to see if it is needed a bit longer or change of treatment. And once your eczema has, or the flare-up has been treated, then we advise to strongly go back on emollient. So even when your skin is better, really important. Absolutely.
Do we know what causes eczema?
It's genetics, so we do see it run in families. Environmental, we talked about humidity, for example. And then later on in adulthood, there's different types of eczema as well, not necessarily adulthood, but more commonly. So you can get hand eczema, so that's more called contact dermatitis.
And what might that come from?
Contact dermatitis is really chemicals, so because our hands are more exposed in the environment, you can classically get reactions. So if a hairdresser, for example, certain professions are more prone to getting eczema on their hands, so it could result from hair dyes, for example, and that can cause a type of eczema.
Are there some sort of barrier methods? Can we wear gloves? Are there any extra tips for that kind of eczema?
Yeah, so gloves definitely. So obviously avoidance is sometimes very tricky for in certain professions. Emollients, so if you're washing your hands all the time, it's really important to ensure you're moisturising. So I always say, as well as have a little emollient in your bag, for example, a smaller version of it. Yeah, carry it wherever you can. And then when we talked about steroid creams, so we probably do a higher potency because the skin barrier is much more thicker on our hands compared to our face.
Some people can become irritated or express allergies to, for example, the jewellery that they wear.
This is when we buy cheap jewellery.
Cheap jewellery.
Is this what we're talking about?
This is what we're talking about.
Green necks.
Yeah. So jewellery that can cause eczema, so contact dermatitis. Also as well, certain fragrances can cause eczema, contact dermatitis, and also specific and certain types of clothing as well.
So that's one other type of eczema. What are some other common types?
There is nummular or discoid eczema. So as the name suggests, they tend to be kind of coin lesions or patches that can occur. Again, triggers, it can result from a skin injury or an insect bite, for example, and widespread as well, so it can be all over the body.
Do you have any advice on how to stop children kind of scratching or worrying at their eczema?
Yeah, so children tend to rub as opposed to scratch. That's probably a sign to look out for if your child is rubbing their skin, keeping their nails short, and mittens, so to avoid them scratching, because the problem with scratching is that can expose the skin and then bacteria can seep in and that causes infection, which is a complication of eczema and getting infected eczema. So it's really important to try and prevent, you to try and prevent scratching your eczema.
And what about the sun and eczema? Do we need to take extra care of eczema skin if we're out in the sun?
So I think the same principles as we always say. I know people feel that the sun can be helpful for their skin. However, it's really important to use sun protection. So there are lots of eczema-friendly sun protection creams or lotions out there.
So don't skip the sunscreen.
Absolutely not. Yeah.
And does perimenopause or menopause have any impact on eczema? I feel like it has an impact on absolutely everything else. So does it have any effect on eczema if you're a sufferer?
We do see a rise in eczema when you reach the menopause as well. I think there's lots of, we lose our estrogen, so the skin barrier is affected. So that can make you prone to having eczema flare-ups. Treatment principles are similar, but if you are troubled by it, then it's important to speak to your GP.
If your eczema is causing you sort of emotional distress, what should you do then?
I think it's really important to seek help early. So again, speak to your GP about getting help and support for that. That's both for children. We know it can have such an impact on their sleep, school attendances, for example, even impact on their behaviour as well. So it's important to get your health visitor or your school nurse or GP involved. But also in adulthood, we know how distressing it can be, as with all conditions. So always, always seek help early.
On to my favourite bit now, our myth-busting segment, where I'm going to ask you whether things are true and false. With all skin conditions, there's always plenty of kind of misconceptions or wives' tales, call them what you will, and I think there's heaps with eczema. So eczema is just the same as dry skin, true or false?
So it's a dry skin condition, but eczema is a chronic inflammatory condition, as we talked about, and essentially you get dry, irregular patches of inflammation, which tends to be red patches, but in darker skin we may not see that redness.
Eczema is contagious, so you might catch it from me if I'm sat here and I've got it.
No, absolutely not.
It's definitely not contagious. Eczema is completely curable, true or false?
Unfortunately not. So it's really important that when we are educating parents, guardians or patients who have eczema, that it is a relapse-remitting condition, which means that it can get better with maintenance, but unfortunately there's flare-ups, so hence why prevention is really important, and treating flare-ups early is really important.
If you're a mum or a dad with eczema, your children are always going to have it, true or false?
Not necessarily, but we do see it run down in families. So asking about a family history of eczema is actually important when we're diagnosing eczema in children, for example.
Stress or emotional upset can cause eczema?
It can do, yes. So we know that stress is linked to many skin conditions and unfortunately can flare up eczema. So it's not unusual when I see patients who are going through stress, their skin condition such as eczema will flare up as well.
So anything that causes us irritation or discomfort can make it harder to sleep, and eczema is a condition that can really affect sleep of both adults with it and children. Is there a way of making it easier to sleep when you're having a flare-up or when your child's having a flare-up? What are some tips for that?
Yeah, so in terms of the room, you could definitely try to keep the room as cool as possible. So maybe using a humidifier or using an air conditioner just to keep the room nice and cool. For young children or just children in general, or to be fair, even teenagers or adults, maybe wearing cotton mittens just to help reduce the scratching. Some of us, sometimes we scratch in our sleep.
So we're unconscious
Yeah,
we're doing it, but
exactly.
Our body knows that we're itching.
If you need further advice, pop into your local Boots pharmacy and your pharmacist will be happy to help.
Alternatively, you can visit your GP or head to Boots Online Doctor for more advice and services.